I actually think that it definitely, even just the brightness alone, because I feel like filler will kind of dull you. You know what I mean? You almost get that like dull eye underneath with filler, and I just feel like with PRP you get that bright eye, and I just love that. So yeah.
In this Backstage Pass series, we have authentic conversations about the evolving role that aesthetic procedures play in your life. We also dive into the often overlooked steps that you should understand before making the leap to your renewed self. These are the conversations that you want to hear, but just don't have access to until now.
We get a lot of people that ask, what exactly is PRP? PRP actually stands for platelet-rich plasma, and so we explain to the patients, exactly what it is. And, we will draw your blood, concentrate the growth factors out of the patient's own blood, and use those growth factors, for a lot of different reasons, and so it's been a great treatment.
For that particular patient, why did you choose PRP?
Right, so in the patient with hollowness under the eyes or dark circles under the eyes, we prefer PRP over filler for several reasons, one of which is significantly safer.
I love it for under eyes, especially because it's really the only thing that will really brighten the eyes. You're not really going to get that, and honestly, we don't do filler underneath the eyes. I mean, we're not going to do that. So it's just one of the leading causes of blindness too.
I was going to say, what are the risks with that?
There's a lot of risks.
Yeah, a lot of people do filler under the eyes, and we can do it, but we choose not to because of the risk.
Yeah.
And you get that puffy look anyway. I feel like you just don't ever really get that just like smooth transition like what PRP does.
Well, and the PRP helps with the collagen production, right?
Yeah.
So why would you not go that route, you know? Yeah.
So I always tell people that, if you inject a filler under the eye and, you hit one of the blood vessels, I mean, it can cause you to go blind in that eye, but then I always say if, you can inject a gallon of PRP into the vein, and it's not gonna have any effect really.
Right.
So it's safer. I think the results are better just for under the eyes.
Right.
And we've had a lot of success with it.
Yeah. So there's no risk with PRP?
Well, there's really no reaction, right? Because it's your own blood.
Yeah.
So at the same time, there's no foreign objects, so you can't really have any type of reaction to it. You can't have an allergic reaction because it's you.
Yeah.
So it just makes sense, yeah.
So when you guys do the under eye PRP injections, how often would you recommend that so that I'll know in the future?
Sure. I mean, I'd probably say about every 4 weeks for about 3 treatments, and then we'll kind of just do more of, just kind of when they want to come in after that, just to make sure that they're definitely not going to be depletion, we just want to have them maintain that.
Okay. Yeah, I agree with Kristen. I think you get your best results with a series of 3 treatments.
Okay.
And then after that is sort of maintenance, for lack of a better word.
Yeah. Okay.
Yeah, and then a lot of times what Kristen and I both will do is if we're doing filler, like in the cheeks or something like that, then we'll also add PRP at the same time. One, it will increase the natural collagen production in the cheek to accentuate the results of the filler, and 2, I think it makes the filler last longer as well.
I'm loving that lately, and I find that a lot of my patients are really loving that as well, because you actually get the benefits, like he was just saying, of the collagen production and everything, but you still have your filler there, so it's not like you don't have that fullness, so you get to have that fullness of the cheek while the collagen is working. So that basically when you're ready for, so that when your filler kind of goes away in a few months, that's when your collagen is already kind of built up. I actually think that it definitely, even just the brightness alone, because I feel like filler will kind of dull you. You know what I mean? You almost get that like dull eye underneath with filler, and I just feel like with PRP you get that bright eye, and I just love that, so yeah.